Have you ever heard that EMDR is like hypnosis or that it erases memories? Maybe part of you is curious but skeptical, thinking this sounds too good to be true. These myths can create doubt, especially if you're considering EMDR for your healing journey. If you've been traumatized, you might have been taken advantage of and have a hard time trusting. So, today, in part 3 of 4, we're going to go through EMDR myths and misconceptions so that you can have some of these questions answered and feel more confident and informed in finding an EMDR therapist. My name is Kitty. I am an EMDR trauma specialist in private practice right here in Central Texas. I make educational mental health videos with real talk for real people just like you. I draw from my lived experience of trauma and recovery, along with my clinical expertise as an EMDR certified therapist that also uses internal family systems and interpersonal neurobiology. All right, let's dive in. There are so many myths about EMDR among people, among professionals, among all types. That is totally understandable that you may have some anxiety, especially if you've heard some of these kind of weird woo-woo stories about EMDR, because if you've never been through it, you don't really know what it's like. If you're hesitant about EMDR, you are not alone. Part of you might think, what if it's just a fad? What if it doesn't work for me? In fact, I almost always will have somebody before doing EMDR wondering if it will work for them. They always wonder if they're going to do it wrong or if there's a right way to do it or if their brain can do it. But if you go back to either part 1 or part 2 in this series, you will see that every single brain is wired for doing this process. Now, it might look a little different for each person, but every brain is wired to do this process in some way when they get matched up with the right therapist for them. Okay, so go back and look at those videos if you're wondering about that. As we go through these myths together, I want you to just notice the skepticism or the anxiousness and just let it listen to the information that we're about to go through about these myths so that it can feel confident and calm in moving forward with this journey or determining if EMDR is not right for you, because that's okay too. Myth number 1 is that EMDR erases memories. That is not true. EMDR does not erase the memories. Instead, what it's doing is it's helping reprocess them, which removes the emotional intensity of the experience of what you went through so that it doesn't feel overwhelming. Because a lot of times when we're having, say, flashbacks or nightmares or hypervigilance or something like that, we're reacting to a memory that is long ago in the past, and it may feel outsized. It may feel illogical to have this reaction in the present, but it's because your nervous system is still reacting to the stuff in the past. So by removing the emotional intensity of that experience, you can move forward with holding on to the thought or the memory without the pain and the emotional intensity of it. You may still look at that memory and feel like that wasn't okay, because it probably wasn't, but you're not disturbed by it. You're no longer emotionally reacting to it because of that disturbance. But nobody is erasing your memories. Nobody's taking your memories from you whatsoever. Myth number 2 is that EMDR is like hypnosis. And the truth is that EMDR is nothing like hypnosis. You're fully awake, alert, present, able to say, I'm out, we're going to cut this off, right? Your therapist isn't putting you under, they're guiding you. I kind of think of it as like I'm a facilitator for your journey through the process. You might be in a deeply meditative state, but you're still fully awake and present. You are not under, there is no, suggestive statements or anything like that. The third myth is that EMDR is a quick fix. Now, there are parts of it that can work very quickly, but the truth is that every brain and every system and every story and every person has their own time to go through the process. So there are some thoughts that once we get into the reprocessing phase of EMDR, that can go very quickly. And that's true, but it's not magic, it's neuroscience. Sometimes people think I'm going to come in, I'm going to do like 4 sessions and be done. That is not the case, especially if you have complex PTSD or many events of event related trauma, then it's not necessarily going to be quicker for you. It could still take just as long than as talk therapy. It's not a quick fix, though. Everybody's journey is different. A lot of times people think that EMDR is only for severe trauma, and that is not true. EMDR is excellent for PTSD. Yes, that's true. But it's also used for things like anxiety, phobias, grief, self esteem struggles. If you have any sort of distressing memories or beliefs, EMDR may help, regardless of whether you've experienced big trauma or little trauma. Your brain can't actually tell the difference. So, how I think of trauma is that it's the moment in which you had to abandon yourself in order to stay emotionally, spiritually, physically, and psychologically safe. It's that moment of installation of a negative belief about yourself because the truth is you were not born thinking you're dumb, shameful, unworthy, and don't matter. Nobody's born thinking that. You learned it at some point. We're trying to get to that moment in which you developed that negative belief about yourself. The next myth is that it's too intense. The truth is that EMDR is designed to move at your pace. So, a good therapist is going to spend time helping you establish safety, trust, and coping skills before diving into that deeper work. If it ever feels like too much, please let your therapist know that this is going a little too fast for you. People often think that EMDR is just the eye movements, and that is not true. It is an 8-phase model of therapy. The eye movement piece or the bilateral stimulation piece is only a few of the phases. The real healings happens as your brain starts to reprocess those stuck memories and beliefs, making room for healthier, more adaptive thoughts and feelings. But the eye movement piece is just a couple of the phases, not all of it. Think of EMDR as like a framework or scaffolding of a structured format of processing through trauma. Myth number 7 is that you have to remember everything about your trauma. That is not true. You only need to remember the worst part. You don't need to recall or remember every detail of your trauma for EMDR to work. The process really focuses on the emotions, the body, the sensation, and the beliefs attached to the memory, not the whole encompassing details of what happened to you. The other thing to know is that your therapist doesn't actually have to know all the details. That's one of the things that makes EMDR great is because you could have experienced, let's say, sexual assault in which you don't want to share all of those details. Well, you don't have to. I know for myself, every therapist is different, but for myself, I actually only need to know if you can identify that image and if you're getting better or worse as we go through the processing. I don't actually have to know any of the details. So, in that way, your privacy is maintained and you don't have to go into all of that stuff that might be actually re traumatizing for you. Myth number 8 is that EMDR is a pseudoscience. That is a big one. And I know y'all are going to probably come after me for that. But EMDR is an evidence based therapy supported by decades of research. Organizations like the World Health Organization, American Psychological Association recommend it as an effective treatment for trauma. So tell me, which one of these myths have you believed? Have you heard? Have you thought about? Have you wondered, but were too afraid to ask? Post them in the comments below. But just know that EMDR is going to feel a little unfamiliar and strange at first. It's not quite talk therapy back and forth like you might have seen in the movies. It's a fairly structured approach to therapy. So, if you've been on the fence about EMDR, but we're kind of worried about some of these misconceptions and myths about EMDR, I hope this has been helpful for you and that you have some clarity, a little bit of confidence. Go back and look at the first video of the series, which is all about the 8 phases of EMDR. And then the video that comes after that is about how to find a therapist. And we're about to dive into this next and final installment of this 4-part series. So stay tuned. And if you have made it with me this far, thank you so much. Please like, subscribe, share, spread this information around for others to have access to it as well so that they can go on their healing journey. Always remember that calm, curiosity, and compassion is the key to reconnecting us all in this very divided world. All right, catch you next time.